According to the Ghana Health Service, as of last week, total active COVID-19 cases in the Ashanti region stood at 79. But as a result of recent increase in infections, the cases have sharply increased to 104, as 55 new cases have been recorded as of Friday, 15th January. Speaking to Citi News, the Ashanti Regional Director of Ghana Health Service, Dr. Emmanuel Tenkorang, expressed worry over the current situation, as he has warned residents to strictly adhere to COVID-19 safety protocols to prevent an escalation.
The cases in Ashanti region is going up. As at today, we have a total active cases of 104. But last week, our active cases were 79. So the new cases that we've added for this week is 55. That means that the cases are really going up. But you remember that we've all come out from Christmas and the New Year holiday. There were a lot of activities in the course of the festivities. So we believe that that's one reason why the cases are going up. But we are also worried because we realize that a lot of people are not adhering to the protocols and then the guidelines that has been given to prevent the COVID outbreak. And this is a major issue. In fact, the three pillars, that's the enhanced hand hygiene protocol, the social distancing protocol, and wearing of face masks, I think is becoming a very big challenge for us. Because as we go around, we realize that wearing of face mask has gone down, and a lot of people has disregarded the social distancing protocol. And the hand hygiene protocol, we don't see the Veronica buckets, we don't see the sanitizers. But until we get a vaccine, that is the only way that we can use to reduce the outbreak. Also, relating to funerals, we've realized that you attend funerals and the whole place is overcrowded. People are not wearing face masks, no social distancing, no hand hygiene protocol. So we are encouraging the organizers of these funerals to make sure that the participants of this funeral adhere to the protocols.
He added that with the reopening of schools, the Regional Health Directorate will redeploy the various contact tracing teams in order to properly follow up on any potential COVID-19 case that may arise in schools. He says, as part of a comprehensive plan to handle potential cases in schools, it has come up with strategies to link every school with a health facility.
Especially now that the schools are going to be reopened, because the social interactions and then the other issues, especially overcrowding and other things, is going to increase. And for that reason, we need to also strengthen surveillance so that any case that is detected, the contact tracing team will follow up, identify the case, look at the contacts, and then manage the contacts, as we always say. So in Ashanti region, it's our plan to reactivate the contact tracing team so that at least the contact tracing team will follow up all the cases. And then if there's a need to do testing, then we can do it. With the reopening of the schools, we've taken a certain measures. The first is that we've been able to link up all the basic schools with health facilities so that in event of an outbreak, the health facilities will immediately move in to support the schools. We are also encouraging parents and then guardians to make sure that if their ward is sick, they will keep the child at home instead of sending them to school.
Dr. Tenkorang says the treatment centers are gradually getting stretched, and as a result, if more cases are recorded, it could pose a huge challenge to health facilities in the region as fatigue is setting in.
Yes, as at now, we have 7 patients on admission in our treatment centers. But if we are to look back at what happened in 2020, We don't want it to happen this time because the centers are getting straight up. Fatigue is setting in, and we believe that if we all work together, at least the cases will go down and there will be no need for us to put people on admission with all the challenges that's associated with it. Because the system is getting increasingly challenging.